Do you suffer from fatigue, brain fog, bloating? Well, you may have a condition that your doctor may not even be aware of. Here to tell us more is Dr. Peter Kahn, who practices functional medicine and chiropractic neurology, and he's brought his patient. This is Stephanie Serio. Welcome to both of you.
Thank you.
Dr. Kahn, I want to start with you. Are these conditions that we just mentioned, are they related? I know you're an expert in the thyroid. Are they connected to the thyroid?
Yeah, these symptoms can mimic a low thyroid condition. However, most people with brain fog and fatigue are misdiagnosed because current medical model is focused on masking the symptom with drugs and surgery while ignoring the root cause. And this leaves many people suffering and frustrated with no relief. Now let's go over some terms here. Brain fog means that you have lack of focus, you have memory recall issues, you have poor mental clarity, while fatigue is describing like lethargy, you have exhaustion. Even if you sleep, you wake up still feeling tired. Now the problem is that medically speaking, there's no diagnosis of brain fog, so there's no treatment. The reality is that when you have brain fog, it literally means that you have inflammation in your brain.
So what causes that?
The most common cause that I find is due to a condition your doctor may not know about called leaky gut syndrome. Now, leaky gut is where you have chronic inflammation and chronic damage to your intestinal tract, causing malabsorption and inflammation. This is due to infections, toxicity, food sensitivities. Now, research have identified leaky gut as linked to autoimmune disease like thyroid, Hashimoto's, rheumatoid arthritis, lupus. I have identified leaky gut in people with difficulty with weight loss, with chronic fatigue syndrome, with immune challenges, and even thyroid problems.
And Stephanie, you were suffering from a lot of these symptoms. What were you dealing with, and how did it affect your daily life and your work?
Sure, I was dealing with sinus infections a lot, bloating. I work out a lot, and so I would go to bed, I would wake up, I'd have a flat stomach, and then after eating or drinking, I was bloated.
Wow.
And it was frustrating for me. It was affecting my work life, my home life.
You were sick all the time.
I was sick all the time. I had no energy. I was depressed.
Yeah, so that those, again, all of these linked together, even though they're seemingly unrelated. When did you decide to go see Dr. Kahn and do something?
After seeing several doctors and having surgeries, and I felt like he was my only chance to feel normal again.
And how quickly did you start seeing a change?
It was about 3 months.
Is that a typical patient for you, Dr. Kahn? 3 months?
Some faster, some slower, but she's a very classic case where we address her problem by healing the root cause. In our case, gut infections and leaky gut.
Yeah, so you had multiple infections though, right?
Correct.
All the time. Is that also a symptom?
Yeah,
that you're
usually
constantly
when people
sick?
have chronic issue, there's more than one thing. And people are looking for the one thing, and we've got to look at the whole person.
How do you feel today?
I feel great today.
Yeah, can you believe you've got clarity?
I know.
Because you were talking about the brain fog. Well, if someone wants to get help like Stephanie, what do you recommend?
Well, there's so many things that people can do, and I realize I can't cover them all here today. So I'm offering those of you watching at home a health discovery session, and during the session you're going to gain clarity as to the missing piece that's holding you back and what you can do next to get better.
Right, and you're on the road to recovery. Will she continue to get better? Or?
Absolutely.
All right,
yeah.
Just getting started. Well, thank you both for being here. Great information. Let's give you that information one more time. The first 25 callers who qualify, you are going to get a health discovery session at no cost. Call 480-988-6269 or visit askdrkahn.com for more information.